A milestone moment, the first dose of optimism in what has been a dismal year. A 90-year-old woman in the UK has become the first person in the world to receive a clinically approved coronavirus vaccine. Just before 7 a.m., retired jewelry shop assistant Margaret Keenan made history, getting the first dose of the Pfizer-BioNTech vaccine. She turns 91 next week and said this is the best early birthday present she could wish for. It is welcome news, not just in the UK, but around the world. So much hope of a return to normal life resting in these tiny vials. It's been just 332 days since the first death from COVID-19 was reported in China, and it's since invaded every country, infecting more than 67 million people and killing more than 1.5 million. These initial doses of the Pfizer-BioNTech vaccine are the start of the world's biggest mass vaccination program. Canada is on track to be next in line to get it. Because it needs to be kept at minus 80 degrees, it is a logistical challenge. In the UK, the first doses did not go to residents in care homes. It was given to people aged 80 and over who are already in hospital, along with nursing home workers and some healthcare staff. Crystal Goomansingh has our top story on what's been dubbed V-Day in the UK.
I'm happy it's happened, and now I've done it, and hopefully it'll help other people to come along and do as I did.
Do as I did might be the 2020 version of the old Rosie Riveter We Can Do It campaign. COVID-19 has been talked about in battle terms, and Margaret Keenan is the face of Britain's vaccination counterattack.
So make this arm floppy and this arm floppy, all right?
No, bossy boots.
That's why I'm in Navy, sir.
People over the age of 80 and some medical workers are the priority. 50 hospitals are being used as vaccination sites because the Pfizer-BioNTech shots must be kept at minus 70 degrees Celsius. The mass vaccination effort is a historic step forward for the UK.
I'm feeling very emotional today. It is really quite remarkable. We, less than a year ago, were treating the first patient with COVID.
The virus has caused immense anguish. Families kept from dying, loved ones, non-urgent surgeries canceled, and medical staff pushed to the edge.
I mean, in terms of how the nursing profession is feeling in the UK, they are tired, they're exhausted, they have had an extremely stressful year, 2020.
But it's not over yet. Millions need to be inoculated. So far, the government has enough vaccine for 400,000 people, but some fear a shot produced in just 10 months.
It's safe, it's the right thing to do, it's good for you, and it's good for the whole of the country.
They want to know how it applies to them, what are the risks, and how would they be able to obtain it. So we've got a big public health communication task ahead of us in the UK, and indeed, I'm sure, in other countries.
The hope is eventually the vaccine will shield society from its current enemy. Crystal Goomansingh, Global News, London.